Today we want to speak about dengue. Yes, and when we speak about dengue, we can automatically look at dengue fever, a black-bone fever, as some folks would refer to it too. Right? So let us see what is dengue fever. Now, dengue, a mosquito-borne viral disease, and this causes high fever, headache, and joint pains. It requires urgent medical attention, is usually recommended by healthcare providers. It can be dangerous or life-threatening if untreated. Is the condition treatable? Yes, treatable by a medical professional. Does diagnosis require lab tests or imaging? Yes, it requires a lab test or imaging. The time taken for recovery. Now, the time, it can last days or it can last weeks. Is condition preventable by vaccine? Maybe preventable by vaccine. Now, note I say maybe. Now, how is the condition transmitted? It is transmitted by mosquito bites or through mosquito bites. Now, so how does it spread? Usually it is spread by a female Aedes aegypti or Aedes mosquito, which normally bites an infected person in the morning to take a blood meal and spreads the virus anytime in the day. In 2 to 10 days, the mosquito becomes infected and virus spreads to other tissues and is released into saliva. Once the mosquito bites an uninfected person, the person becomes infected. The mosquito is usually infected for a lifetime. The other way in which it spread, it is through blood or organ donation from an infected person. So here you see the mosquito biting into the skin. What are the symptoms? So if you or someone you know is exhibiting symptoms of dengue fever, seek medical attention immediately. But look at what the symptoms are. Commonly observed symptoms are as follows: sudden onset of very high fever, severe headache, usually at the back of the eyes, muscles and joints becomes painful, development of skin rashes, fatigue, vomiting, mild bleeding. So we see a demonstration in picture form of the things that happen, the symptoms of the dengue fever. Is it preventable? Can it be prevented? Yes, dengue fever vaccine should be taken. I will touch some questions about that. Exposure to mosquitoes should be avoided. This is possible by drainage of stagnant water, inhibiting breeding of mosquitoes by application of oil to stagnant water, application of insecticides to open waters, sleeping under mosquito nets, application of insect repellents, and wearing clothes which cover the whole body. So these are some of the preventative methods. Can it be treated and managed, or treatment and management? Because that's how is dengue fever treated. There's no medicine that treats dengue fever. Your healthcare provider will give you recommendations or how to manage your symptoms and if and when you should go to the ER. How do I manage the symptoms of dengue fever? Managing your symptoms is the only way to treat dengue fever. So follow your healthcare provider's recommendations, which may include keeping yourself hydrated by drinking plenty of water and fluids, getting as much rest as possible, treating pain with acetaminophen like Tylenol only, or do not take ibuprofen like Advil or aspirin, because this can increase your risk of life-threatening internal bleeding. So here we have a whole dossier on COVID, on dengue fever, and it is advisable for those of you, especially in Trinidad, that you follow the guidelines as provided by the Ministry of Health. Dengue is on the rise in Trinidad and Tobago. Number of people have gotten it and some have died. So we need to pay attention and follow the guidelines so that this, what could be fatal disease, do not affect you. Thank you so much, and I hope that you would take heed.